Welcome to the channel, it's Kevlar with another tech video, and today we're going to talk about KardiaMobile. This device here is fantastic and it may help you as it's helped me over the years. Now, this device is great for detecting arrhythmia. It's helped detect atrial fibrillation probably about 3 or 4 times for me over the years, which is fantastic. If you don't know what atrial fibrillation is, it's a regular heart rhythm of the heart. It starts off in the atria. They basically don't beat properly due to electrical signal problem that makes the heart go a bit chaotic and can cause things like breathlessness, tiredness, fatigue. Your chest is just palpitating really fast. It's a horrible feeling. But it does detect other arrhythmias like tachycardia. That's beats over 100 beats per minute. So if you go over that, you could be in tachycardia. But some of us moving around day to day will go over to 100 beats. But this is over time. So if your resting is over 100 beats, then that will be tachycardia. Now, I'm not a medical professional or anything. I just do this because I'm very passionate about it. But another heart rate it detects is bradycardia. That's slow heart rate. So heart rate below 50 beats per minute. But some of us could have a slower heart rate anyway. When I'm training and doing a lot of cardio, sometimes my heart does go quite low, and it has been 40 something beats and said I'm in bradycardia. However, I wasn't worried. I just knew it's because I'm a lot fitter. But if it's something shown for you over time, it's something to get checked by your doctor. Now we're going to jump in and I'm going to show you how it works and go from there. Okay, we're now in the app. So what I'm going to do is show you just on here. You want the arrow. So it's sort of like an arrow pointing up. And what we're going to do is place both thumbs on here. Now, once they turn green, it's going to start recording. Now, it is going to start off a bit jiggly, but that will kind of level out. And there you can see my heart rate at 76 beats per minute. I am supposed to be silent during this, but the benefits of this KardiaMobile device, it will pick up bradycardia, so that's obviously heart rate under 60 beats. Tachycardia, which is beats over 100, and also atrial fibrillation. Now, it will say, it will kind of say possible atrial fibrillation because they can't guarantee it, but that's going to give you the indication that you need to go and get checked out by a professional. I go to A&E, or I take a pill in the pocket, but most of the time I go to A&E just in case it gets progressively worse, because I am symptomatic with my AFib. I do get dizzy, I do get palpitations through the chest, and I actually can feel my AFib. But that's a single lead. Now I'm going to quickly show you a demonstration of doing a 6-lead ECG. And what I'm going to do is show you on here. So once we've seen that, you're going to then click on 6-lead. You've got the pad at the back, which goes on your ankle. That's got to go on the left side. You can do it on your knee as well. So what we're going to do is we're going to place that. And now that's doing a 6-lead ECG. Now, when I showed my cardiologist this, he was absolutely shocked how good it was. For a home device, it is absolutely amazing. And then obviously you can carry this and take it anywhere, and you've got a backup to check an ECG while you're on the go. Now that's the 6-lead ECG. We're going to see the results. We are going to click this icon here, and this is going to download. Now, you can set a password for yourself. So if you're sending this to someone, it's maybe got a shared email, and you would like it just go to one person, you can set a password on there. We're going to click download PDF. We'll open that with Google Drive. It says here my beats were 87 beats. It says I'm 56 years old, which I'm not, but it's Kevin Attack, my channel. And then down here, it's got your heart rate of a 6-lead ECG. Now, in the States, they do call it EKG. Over here, we call it ECG. But it's absolutely amazing. When I showed, when I've gone to A&E before and I've showed them this, they just think it's absolutely amazing. It's nice to have this at your fingertips. Now, I'm going to show you, we're going to go back in here. We're going to put save and close. Now, we're going to click here, upgrade. Now, with the basic package, so basically you don't pay for anything, you download the app, you're set to go. You do have this if you did want advanced features of this. Basically, it's $8.99 a month or $79.99 for the year. It will detect 3 more arrhythmias, including PVCs, which is premature ventricular contractions, bit of a mouthful there. But basically what that means is the atria of the heart. So the atria is the 2 top chambers of the heart. You've got 4 chambers and you've got the ventricles at the bottom. Basically the premature ventricular contractions means your heart is beating a bit too early with the ventricles, to my knowledge, but I'm no doctor. That's something you need to speak to your cardiologist about, or maybe you want this device just for reassurance. You get up to 4 EKGs reviewed by a cardiac technician annually. So if you've got certain ones that you're a bit concerned about, you can get that checked out as well. You get reports summarized of your ECG recordings every month. Share your report with a doctor. Use it to track your heart health over time. Gain better understanding of common symptoms, track the EKG and blood pressure trends. So you can track your blood pressure through this. Sorry, you can upload the details of your blood pressure, and then you've got the combination of the two. So that can track that. You've got automatic ECG sharing, so that you can send that to your inner circle. So maybe you're someone who lives on your own, and maybe you want to share that information, and that will go straight to them. Detect changes in your heart rhythm, so maybe your heart rate and everything. It is pretty good because it picks up, it asks the question, is it me or is it a guest, which is pretty amazing. And then you get cloud storage. I don't upgrade. I did upgrade for about a year and I found the information to be really, really helpful, which is absolutely amazing. So I don't upgrade personally, but that is up to you. But I will show on screen in now, just so you can have a look at what the extra info it does detect, just so you kind of got that. But with terms of the history, looking here, this is times your heart rate and everything as well. So I think it does an excellent job. And this is absolutely amazing. Actually, I've got it here. So detect 3 more arrhythmias. So it will detect sinus rhythm with PVCs, the premature ventricular contractions, sinus rhythm with SVE. I'm no doctor, I can't really say that what it is. And then you've got sinus rhythm with YQRS. It is brilliant if you did upgrade. However, I'm happy with the basic because my goal is to detect atrial fibrillation, which I've had, and this has detected it 4 times now. And every time I have gone to A&E, they're picked up on it, which is absolutely amazing. And it shows this device is right. However, I'm no doctor, but it is FDA cleared, and I think this is a great help. And this may be a great help to you. And that was a quick overview of KardiaMobile. Now, one thing I would say for the disclaimer to cover me, I'm not a medical professional. And if you are getting in palpitations or arrhythmia, the first thing you want to do is see a doctor. One thing I would say with palpitations, not all of them are harmless, but I'm not a doctor. That's just going by my personal experience. But one thing I would say, when it does detect atrial fibrillation, it does say possible atrial fibrillation. I guess that is to cover them, and it may not be atrial fibrillation. But every time my heart has been in AFib and it said possible atrial fibrillation, I have been in atrial fibrillation, and that's been backed up by when I've gone to A&E, to the hospital, and I've been put on a 12-lead ECG, and that's been picked up. Now, with the bradycardia, it just says bradycardia because that is anything below 50 beats. With the tachycardia, that's anything over 100 beats, so they can say that. So, but it is a fantastic device, and it's helped me massively over the years, and I would truly recommend it for anyone that is experienced AFib, especially like me, I have done over the years. And it does detect more than that, like premature ventricular contractions as well, like I said, but you've got to pay the extra. But personally, it's a recommended device, Kevlar approved, absolutely loved it. And it is FDA approved. So FDA cleared, it says on the box. So yeah, I would recommend getting it. If you like this video, like and subscribe, and I will be back with more tech reviews.